questions of short answer questions or maybe short note, and list parenteral route of drug administration with example of drug or drugs, okay, given by that route. Means there are different parenteral routes. So that is the first objective. Describe the advantages and disadvantages of parenteral route of drug administration. As I discussed in oral, it will apply same for parenteral. And the last two, that is a demonstrate how to administer drug through various route, various parenteral route, and the communication with the patients, that is going to be covered during your practical class. And of course, the demonstrations in the terms of the directly observed procedures skill, or you can say OSPI. So that will be covered during your practical class. If time permits, I will talk about in detail of topical route also, and I can complete both route today. Last time I have discussed like there are certain factors which decides the route of drug administration. So again, that factors, they are the first is the drug factor, that is property of drugs, and the second factor is patient's requirement, or you can say the patient's condition. There are broad divisions which can be given for overall route. So here you can say that the drug which is given for the systemic action, so that route is called systemic route, which includes enteral, that is oral, sublingual and rectal, and the second route which gives systemic action, that is parenteral. So broad division would be like this: systemic routes, enteral and parenteral. And the second route is local route, that is the drug given through skin or maybe mucous membrane. Okay, so that is topical route where you have to apply by drug by these two route for the local action. So this is about the broad division. I have covered the oral route. So now I can start with the parenteral route. I told you par means beyond and enteral means intestine. Beyond intestine, when you give drug, the route is called parenteral. Enlist the different parenteral routes could be of intramuscular, could be subcutaneous, could be intravenous, and there are other routes also. I will let you know one by one. What is the overall advantages of parenteral route? Because directly drug will enter into the blood. You are giving through injection. The actions will be fast, so rapid onset of action. So can be preferred in emergency. Can be used in unconscious and uncooperative patient. You all know. Especially the presence of vomiting. If here comes the patient's factor. If patient suffering from vomiting could not take drugs orally, can be used route can be used parenteral. Then there are certain drugs which is having high fast metabolism, so drug will not, the property will not allow to drug to act and maybe to inactivate. So that type of drugs can be given via parenteral route. I will let you know. Please don't worry that. Just now remember the advantages. And the drugs which is destroyed by digestive juice can be administered via parenteral route. See, there is a one, the key which you can remember, but don't quote me anywhere that madam has told. Just remember, these are what are the advantages of parenteral could be of a disadvantage of oral. It is a zigzag manner. Just you can observe here, rapid onset can be used in emergency, of advantage of parenteral. This statement could be disadvantage of oral route. So just you have to apply that what are the advantages and disadvantages of parenteral. Here the disadvantages of parenteral could be of advantage of oral. So it requires sterilization and aseptic conditions, especially parenteral. Painful, of course, and invasive technique. So it could be non-compliant for the patient, means for patient, it cannot be easily digestible. They cannot comply for this technique. It can cause local tissue injury And of course, these type injections, the route where you have to use certain injections, it is expensive. So these are the disadvantages of parenteral route. What I have talked, that is about general advantages and disadvantages of parenteral route. As I told you in or during the discussion of oral route, there are certain dosage form which has its own advantage and disadvantage that will be covered in practical class. Same, it will be implied for parenteral route. There are certain routes which is called parenteral, and its advantage and disadvantage I have written in a brief manner. Again, in discussion, during practical discussions, you will know in detail. See, the first and least parenteral route, you can say the first route could be intravascular. So here you can say intravenous and intra-arterial. So the injections, the drug which is given by intravenous and intra-arterial. What is the advantage? That directly blood will enter into the blood. The blood drug will enter into the blood. The advantage is it is a precise, accurate, and immediate onset of action. So rapid onset and 100% bioavailability. Now for this route, just now you remember that IV has 100% bioavailability. If you remember, I used this term during oral route also. Rate and extent of drugs reaching to the systemic circulation. Okay. So IV has the advantage, there will be 100% bioavailability. The disadvantages could be of the technique or could be of the sometimes drug itself. So one intravenous, the key point is 100% bioavailability. Coming to the technique, there are two techniques which is used for the intravenous drug. One is called bolus and other is called infusion. Can anyone has heard this term? And if somebody would like to explain that drug can be given through bolus or drug can be given by infusion. Can somebody would like to explain this term if they know? Fatafat? Yes. What is bolus? When you give drug in a bolus or when you drug give in an infusion? Or I think let me give you assignment. Please find out two statement. Somebody said, who wants to say? Bolus means lump? No. No. It is a technique where the, remember, I can give you hint that it is in the term of dose. Okay. So just find out what is bolus when it is given, when the intravenous route is used, and what is infusion, at least two lines. That applied for the bolus and infusion. Bolus is giving drug over long duration. No, that is also wrong. Short duration, large dose. No, 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 no. Okay. So you just find out. Okay. The irritant drugs and not absorbed orally drugs can be given via this route. So that is the advantage. Yes, somebody said, Steven said that drug is infused slowly over hour. Very good. When you have to give drug slowly over hours, means drop in a drop manner. You have to calculate. If you see in the patients, there is a pint which is going on and the drug is administered via these intravenous route where one has to calculate the dose, that is drop wise per minute. You must have done this exercise during the practical class. So that is infusion. And bolus means when you give a large dose at a time, once at a time, then it is called the bolus. Okay, fine. Now concentrate for the other points. Large volume can be administered. Okay, intravenously. If you want to give large volume, you can give bolus. If you can use infusion also. Only the disadvantage is that oily solutions or colloidal solutions cannot be administered via venous route, intravenous. So here again, please remember the drug factor and the patient factors, very important to decide the route of drug. Okay, coming to the other route is intramuscular. So that is also you will, discuss in detail, but here the advantage could be the rapid action. And here the drug can be given in a suspension or the emulsion. So if you see that there are vial is available, ampoule is available, and inside that there are drugs. Okay. And that drug dosage form and the drug consistency could be labeled it as a suspension or emulsions. That is means it is available in an aqueous solution. So intramuscular route can be used where the drug is available in an aqueous solution. Disadvantage, it is a similar kind of disadvantage of parenteral, that is pain at injection site. The other route is subcutaneous. Please remember the example of insulin. Here the drug has to be given under the skin. You all have to demonstrate how to give intravenous, use intravenous route, use intramuscular and subcutaneous route. Okay. So that is a hands-on activity and that is you all have to demonstrate. So these three routes we ask you, there is a special exercise for during your practical exam as well as in class. The other route is intradermal, that is drug has to given into the skin, and especially intradermal, if you know, there are certain skin testings which is done for some allergens and as well as the Montauk's test, especially for the tuberculosis patients. For these tests, the intradermal route is used. Intrathecal means one has to canal, and especially it is used as a for the anesthesia purpose. Intraperitoneal means the drug has to be given into peritoneum, and especially example for the peritoneal dialysis in case of renal insufficiency. So the first objective which I told you, enlist different parenteral routes. These are the different parenteral routes and you have to give one examples of each. Again, it is given in our manual and there is a special class for these all routes into detail with the example of drugs. Okay. So there are some pictures how to give subcutaneous injection, how to give intramuscular injections, how to give intravenous injections. I will provide a link after the completion of this class. You can take snapshot or the screenshot, or you can write down that link and you have to see how to give these injections. Okay. So the steps are there. So I will give you link for that. So for the systemic effect or the systemic action, I have covered the oral route. I have covered the parenteral route where the drug is given by the injection. The other route is where the drug is given through inhalational route. You all have discussed that there is some aerosols which can be used. Gaseous and volatile agents can be used through this inhalational route. So here the particle size, what is the important characteristics of the inhalational route here? The drug factor is particle size of the drug is very important, or the property for the efficacy of the inhalational route. So I have written here, see, when somebody is taking the drug via inhalational route, means drug has to circulate into the lungs also, but it has to pass through the bronchial tree. So solid and liquids, they are excluded if larger than 20 micron. The drug particle which are more than 20 microns cannot be effective via inhalational route. Okay. So here the particle size, the impact in the mouth and throat. What is the particle size here? If it is a 2 micrometer, it reached the bronchiole, and if it is more than 5 micron, then it get impacted in the upper respiratory area. So between these two, the 2 to 5, there should be the particle size of the drug. So it can reach to the local site where you require the action. There are certain devices which is used again. Once you join physically, you have to demonstrate how to use certain the device. What is the term I have used for inhalational route? That there are certain devices which is used for this route. See, first I picturized here, that is called meter dose inhaler. And you all must have seen these devices anywhere, somewhere else, whatever, at home, outside, or in the hospital. So this is one of the device which is used for the inhalational route. There are other device which is called rotahaler, loop haler, nebulizers. These are the some of the devices where you all have to, which you have to demonstrate, and you will see physically this all devices. Okay. Just now you remember the inhalational route. Again, the rapid action. It is giving systemic action. It is the route for the systemic action, and particle size is matter for this dose route, and there are certain devices. So these are about the inhalational route. Again, the advantage is rapid onset of action, and there is a rapid access to the circulation, the larger volume, the large area of lungs, highly vascularity, and again it is light sublingual, first pass metabolism is avoided. So advantage of inhalational is again rapid onset of action, but yes, for the systemic action. Drug is directly delivered, smaller dose is needed, so toxicity is much lesser. There are certain physical properties of the drug which is available. The drug is available as a gas, especially the general anesthetic agents. Drug can be available in aerosol, and there are certain drugs, you can say salbutamol. It is frequently used, commonly used drug in the patients suffering from bronchial asthma. So remember, if you can remember the name of the drugs and the route. Okay. So inhalational route, salbutamol is one of the drug example in bronchial asthma. As a powder, again there is another drug which is called sodium chromoglycate. That is also one of the drug which is given in the bronchial asthma, especially in allergic asthma or maybe for the prophylactic treatment. So just now you remember inhalational route and the example of the drug. Advantage, you all know, rapid onset. Disadvantage, irritant gases may enhance pulmonary secretions. So again, here comes the drug factor. Should be avoided if there is a irritant gases, cannot be used for the general anesthetic agents or for any other purpose. The difficulty in regulating the exact amount of dose. Difficulty means why it happens, because there are certain devices patient you need to instruct the patients how to use and what can be the dosage. But sometimes it happens that there may be difficulty in regulating the exact amount by the patient, or maybe sometimes the prognosis of the patients can it could be a disadvantage of the exact amount. The disadvantage or unfortunate of this disadvantage of route is sometimes these route is used. It is a route of entry of certain drugs of abuse. You all know there are certain drugs. Marijuana is a very common drug, and these route is used for the drug of abuse, and that is the disadvantage as far as the route is concerned. But if there is a for the therapeutic purpose, then its advantage is rapid onset. See, there is another route which is a transdermal. Though the drug is given via skin, through skin, but it will give systemic action. So again, I am telling you that broad category for the systemic action and for the local action. For the systemic actions, enteral, parenteral. Parenteral, you can include the all injections as well as inhalational. And from this local route, transdermal, is also considered to be the route which is used for the systemic action. So transdermal, there is, what is the drug characteristics here? Highly lipid soluble drugs. Okay. Again, in kinetic, you will understand, you will learn in detail lipid soluble and water soluble drug. Remember, highly lipid soluble drugs are applied over the skin. And what is the purpose or the advantage of this route? That it will give a slow and prolonged absorption. Remember, the absorption will be slow, but it will be prolonged. So transdermal is used for systemic actions, but prolonged absorption will be there. It is given in the drug is given in adhesive units. So there are patches available. If you have seen sometimes, or now you can see in pictures in Google, what kind of, once you will join, again we'll show you. But adhesive patches are available. And these adhesive patches, they are available in different size and shapes. So here the absorptions will be constant and absorption is predictable. Okay. There are sites which one has to choose for these transdermal preparations, and that is most commonly for transdermal adhesive patch, one can give this patch, that is on the upper arm, maybe in the abdomen, or maybe in the chest. So these are the sites where it can be used for the transdermal patch. How to apply that patch? That comes under instruction discussed in practical class. For today's theory class, you remember these route is for systemic actions and the site. What is the advantages? That predictable and prolonged absorption can be there. Most common drugs which are used through this route is nitroglycerin. So this drug is used via some other route. Which was the route which I have discussed for the nitroglycerin drug? The common, anyone? Nitroglycerin can be sublingually, right? Very good. Sublingual, yes. Okay, fine. So the transdermal nitroglycerin can be used even for the transdermal route also. The other drug is nicotine patches available, where the drug for the patients who is addicted cannot withdraw the nicotines suddenly. There is a nicotine patch is available where there is a slow and prolonged absorptions will be there, and that can lead to the some of the de-addiction. It is one of the route where it can be used for the de-addictions, but the drug is nicotine. The fentanyl is, again, it is a opioid drug, and it is given in the patient suffering from pain. Disadvantage is that large dose cannot be given. If you require a large dose, this route is not preferred for the large dose. And of course, it is the patches are expensive. So drug are also few which is available in patch, and as well as it is a expensive. The patch is expensive. Okay, so that could be the disadvantage. Again, I have given one example. I think you assignment which we have discussed. What is the bolus and infusion? So now related to the route, I am giving these three terms. You can write down these three terms, and then we'll discuss in my next class that what is the meaning of these three terms. One is induction. Second is ontophoresis. Please write down the spelling correctly. And the third is jet injection. So you all have to find out, you have to able to explain these three terms and the purpose. Okay. So I am going to discuss these three terms tomorrow, but it is related with the absorption and it is related with the route. So just find out what are these three terms. Okay. Now coming to the last route, that is the topical route. Not much about the topical route. Only the topical route means the drug given via the skin, or you can say the dermal, and the second is the drug which is given through mucosal membrane. There are certain dosage form available where you have to apply it through skin, and they are called cream, ointment, liniment, and so on. But the purpose here is local action. So topical routes and which is used for the local action. One is via skin, via dermal route, and the second is if you use drug via mucous membrane, applying directly to the mucous membrane, then they are the eye drops, ear drops, eye ointment, and so on. So there are certain dosage form which is available for the local action via mucous membrane, or maybe via the skin. See, the intranasal route, there are certain nasal sprays available. So that is only for the local action and which is considered to be the topical mucous membrane route. Okay. So here I am not going to tell much detail about the topical because these are going to cover in your practical class, and it is related towards, for practical class itself. So for topical, you will understand the detail in practical. Term this, remember the site. Okay. See, many drugs are administered if it is rectum. For rectum, then it is called suppository. If it is for urethra, local action, it is called boogie. And if it is for the local actions in vagina, then you can say it is pessary. So these are the terms which is used for the local actions or the some of the particular site, and these are called the dosage form. This about the topical local action. So I would say here that I have completed the first first three competency and the last competency, that is 1.11, that is in detail about the routes. So what are the key points you all have to remember for the route of drug administration? That is, there are various factors which determine the route of drug administration. Then each route of drug administration and its merit and demerits, which I have discussed. Then there are various dosage forms are available looking to the various factors. Dosage form in detail we'll discuss in practical class. And there are two broad categories of route of drug administration. If there is a short note on broad category, you have to categorize as per the action, that is local and systemic action. So this is all about the route of the drug administration. See, these are the videos link which you can take a picture of that. You have to see this video, and once you will join, I may ask you these steps, and once you join, you all have to demonstrate it. I have given one example of assignment, that is the explanation of certain terms, and you can find out some name of some highly irritant drugs. Okay, I told you that oral route cannot be used for the highly irritant drug. You required here route. You all have to find out the name of highly irritant drugs. It is very easy to find out, but then it will, it is interesting, so you just find out that. So shall I stop here? You all have note down the link of